It is so stressful. If I had known how stressful, I might not have done this. Hey guys, welcome back. So in the past year alone, I've had so many friends who are early in their careers and they're leaving dentistry, trying to leave dentistry, or they're like super burnt out and they don't know what to do. So for everyone who is considering dentistry, I thought I would do an update on one of my previous videos, which is 5 reasons not to become a dentist. And that video I did 3 years ago, and it covers a lot of the struggles that new dentists go through, like student loans. So watch that one after this one, and also join the fam, subscribe, and like this video. And by the way, if you are new here, my name is Dr. Joyce Kahng. I am a cosmetic dentist, practice owner, I'm a mom, content creator, and I've been out of dental school for 14 years. Now for this video, I surveyed over 50 dentists on things that they hate about being a dentist, and we're gonna tell it to you straight. I told them, just don't hold back, say it as it is. The people need to know. And before I start this section, I wanted to make a point that this is a complex topic. What's hard about figuring out whether you're going to love being a dentist or not is that when you become a dentist, you could love doing dentistry, love people, but just hate the profession. I think the environment of which you work in, it really can sour a profession. And I will say that the environment of dentistry between years ago when my mom was a dentist to now has changed dramatically. And so that is something to be aware of. It doesn't necessarily mean that people are bad dentists or people don't love to do dentistry. It's sometimes not about the dentistry at all. It's about the nuance of the profession and what's happened to it. So the number one thing that unanimously people were saying that they hate about being a dentist is insurance. And I actually have a vlog of when I dropped Delta Dental if you want to check that out, but it is such a power struggle. Insurance is the biggest pain in the butt. They are like the middleman. The patients always get mad at us, the dentists, because their insurance is and when the insurance decides not to cover something, like, we're the ones that the patient is mad at. And that decision was not even really in our hands at all. So other horrible thing about insurance is that a lot of people are still stuck in the Stone Ages with the way that they think about insurance. Insurance has not evolved with inflation at all. So they're paying less and less and less, covering less and less and less every year. People still make all of their dental decisions based on whether their insurance covers something, and they don't realize that insurance is merely a coupon. So yes, there is a definite power struggle happening right now with dentists, insurance companies, and it's at the detriment of patients. And it's hard because patients think that we're rich. And meanwhile, what's happening is that insurance companies are not really paying dentists as well. And so all the dentists that are coming out of school with heavy amounts of dental insurance, sure, they make a good living, like their salary is good, but a lot of it goes back to paying back a huge debt, and the ability to produce is going down because insurance companies are not paying as well. That's sort of the situation at hand. Yes, you can still be very productive and make a good living as a dentist, but unless something majorly changes with dental insurance, it's a race to the bottom. And I think production is also one of those things that really weighs heavy on dentists. The amount that we make as dentists is somewhat unstable. It really depends on how much you produce, and what that means is, like, you don't just go to work and get paid just for showing up for work unless you have a base pay in your contract. You are paid based on how many teeth you drilled, how much money you made for the office. You're paid a percentage of that. And so it's hard because you want to do right by the patient, but a lot of times insurance is undercutting a lot of what you would be paid for doing the procedure, and so you take home less overall, and so does the entire office. Everyone suffers. Yeah, the only people who are winning here are the insurance companies. All right, the second thing that people did not like about being a dentist, hate about being a dentist, is that it's emotionally taxing and high stress. Like, this person said, it is so stressful. If I had known how stressful, I might not have done this. It's getting better though. Yee. Yeah. but she's not alone. This was a very, very highly commented one. Amongst all of these, people are saying that patients are rude, they're difficult, they are ungrateful, and generally patients who come to a dental office, they sometimes bring a negative energy. It's because they don't want to be there, they're scared. I'm not saying that negative energy isn't warranted. Sometimes they're traumatized from previous experiences, but you know who takes all of that energy and absorbs it all? The dentist. There's also a lot of patients that have really unrealistic expectations of what's supposed to happen in dentistry. It's like really, really frustrating because you sometimes care more for the patient than they care themselves, and they will go years without seeing a dentist, come in and expect everything to be fixed or everything to be fixed for free. That's difficult because it's a labor-intensive job, and sometimes even if you want to fix something, you can't because it's too far gone. But patients often say things like, it didn't hurt until you touched it. And they don't really realize that teeth work like that. So you have to go in and remove the disease and the decay, and it may, cause pain. It doesn't mean that you caused it, but you have to do that in order to give the tooth a chance of being saved. People often are very emotional about pain. So I totally get it, but it is really, really hard when you're a dentist because you have to be able to explain these things to a patient. And from what she's saying, it's getting better. I think that, my own communication with a patient has improved so much over the years so that I can be ahead of all of these things so the patients don't get mad at me and I can properly explain all these things to a patient. Now, obviously, some patients still don't really listen very well. I mean, I used to always think about maybe I didn't explain it well, but there are some patients who do not listen, and it doesn't have to do with your explanation. They just do not listen. Those are very, very difficult patients to work on or have in your practice. Some patients are really mean to the employees and you have to kick them out of the practice, and that's just drama you don't want to deal with. Also, dentistry is highly litigious, and so that's another layer on top. But here's the one that got me. Somebody said this and it speaks to my soul, pierced my soul, because this is me. It says, trying your best for patients, but it's not good enough. There is a huge disconnect between patients and their dentist. Now, obviously, if you do get great patients and you start developing that trust with them, this sort of thing doesn't happen quite as much. But it really, again, depends on the environment of dentistry that you do. If you're working at a high volume dental practice and you only have 5 minutes explaining something to a patient, then that's not a good situation for anybody involved. And those are the small nuances and stressors that we deal with as dentists. I'll also say that the way that you handle this sort of stress depends on you. Personally, I think I'm a pretty empathetic person. So when I deal with people who are sad or scared, I absorb a lot of their energy, and I'm capable of doing that, but not every day of the week. And so I could make way more money if I worked 7 days a week. Would you agree? Dentistry is one of those professions where you're always trading time for money. You have to go to work in order to make money. And so I could make more working more, but I don't, because I have to preserve my sanity. I can only work 3 to 4 days and still be personally okay. And I see a therapist every month as a preventative measure because I want to make sure that I'm still mentally strong and able to handle the stress of being a dentist. That's how stressful it is. And I'm telling you this as a dentist 14 years out. I think that therapy is really, really helpful. It helps you to understand why you feel a certain way, because there was a point in my life where I thought, oh my God, I'm so stressed. Does this mean that I hate my job? Does this mean that I'm not a good dentist? If I was a good dentist, why would I be so stressed about my job? And as I progressed in my career, I've gotten better at managing the stress, but also respecting the stress. The stress is there. We behave like therapists almost when patients come to the office and they're scared, and you walk them through the procedure and you are strong for them. We are like therapists for them. And in return, I believe in getting therapy for myself so that I can continue taking care of patients. So that's the reality of how emotionally taxing dentistry can be. It's not something that you can't handle, but stress it can weigh very differently for different types of people. And there's a reason why there are so many dentists who are actually, like, I think that I read this statistic, I'll have to look it up, but there's a dentist that commits suicide every week. Something like that. And I was shocked when I heard that. I was like, oh my goodness, that is crazy. And maybe we should do an entire episode on stress in dentistry and maybe interview somebody who can speak more to this, but it is a major problem in our profession. Not to mention that it is also physically taxing. That's one of the things I talked about in the other video, but dentistry is just really, really physically taxing, and I think people should know that. Okay, number 3 thing that people hate about being a dentist is the aspect of business ownership. Now, being a business owner is one of the pros as well. So let me kind of explain why this is one of the top 3. I never actually wanted to become a practice owner. My mom was a practice owner and I saw her working so hard and I was like, I want work-life balance. I am not gonna work like that. I do not wanna be a practice owner. And so when I graduated from residency, I ended up working at several practices. I worked in volume practices. I tried to find good jobs. I was paid well, but I was working like a dog. I had like 15 minutes per patient. I was super unfulfilled and I would go to work every day and feel a high level of anxiety. I would go to CE courses, expensive ones, and I would come back and I would not be able to implement anything that I learned because my bosses just wanted me to work as fast as possible and produce as much as possible. And so in order to escape that, a lot of times what we do as dentists is we open up our own practices. It's not because we want the stress of being a business owner. Like for me, I mean, for some people, yes, but for me, I would have rather been an associate if I had been able to find a really good practice that let me do dentistry the way I wanted. But you know, when you work for someone else, you have to play by their rules. And oftentimes, if you want to play by your own rules, you have to open your own practice. So there's a lot of stress that comes with practice ownership. That's a whole video in itself, but lots of stress. And I would say out of all of them, the number 1 stress is managing employees. Now, I don't know if people really know this about the state of dentistry, but it is very, very difficult to find auxiliary staff right now. So auxiliary staff would be like your dental assistants. Dental assistants, where are they? They're nowhere to be found, especially dental assistants that want to stay in that position long term. Now, there are some really good dental assistants, but where are they? It's so hard to find them. Meanwhile, a lot of my friends and colleagues are having really hard time even filling the position. Dental assistants or front desk people are not showing up for their interviews. It's becoming a thing. It's like people don't show up for their interviews. Nobody really wants to work in a dental office. The thing with dental assisting is that it is a very difficult job, like dealing with dentists, dealing with patients. I mean, dental assistants deal with all the same stuff that dentists deal with, but the pay is not as good, right? So I think there's a little bit of fixing in this industry that needs to happen when it comes to the people that are in it. I've been very lucky so far. My front desk lady has been with me since the beginning of time. My hygienist has been there for years and years and years. My dental assistant, again, has been with me probably 4 years. But if there is one thing that stresses me out, it is managing employees. And I'm lucky to have a good set of employees right now, but I am always waiting for the ball to drop. Yeah, it's a struggle. It's truly a struggle being a practice owner right now with the pool of candidates who want to work at a dental office. CDA, I paid my dues. Hopefully you get on that. Anyways, I hope that explains why this made it to top 3 on the list. The amount of stress that you get just from owning a business is stressful because dentists have no formal training in being business owners. And like personally, when I first became a dentist, I thought I was or a practice owner, I thought I was like hot shit, right? I thought like, oh, I'm such a great dentist. But being a great dentist does not mean that you are a good leader. You are not a good practice owner. You are not a good boss. I will be the first one to tell you, I have failed many dental assistants along the way, purely because of my own ego. You know, I'm a micromanager too. Like, it's just the personality of a dentist. So I've come a long way. I worked on myself. I'm learning always to be a better leader, but it does not come naturally. And it is a strain. The dentistry is the easy part. The practice ownership is the hard part. Okay, so number 4 is it's hard to get time off. That is a legitimate con of being a dentist. What they mean by time off is sick, holiday, maternity leave, and not having the ability to work from home. So here's one thing that you have to realize about being a dentist is you don't get paid unless you go to work. So if you are sick, like you wake up sick or you have the stomach flu or whatever, you don't get to just call in and be like, I'm sick. You know, you have a whole schedule of patients waiting for you to come to the office. And if you call in sick, it really puts a strain on the business. You cannot just work from home. Yeah, a lot of people depend on you because you are the one person who's gonna produce for that office that day. And if you don't show up, all the people in the office, they're there for no reason. It's a lot of responsibility. And I remember like last year when Preston started going to daycare during the winter months, he was always sick. Me and Byron were like taking vitamin C because we're like, we can't be sick. We have to go to work. We're both owners, by the way. So we have to go to work. And thankfully, like I don't tend to get sick, but I take very, very good care of myself because of that. Maternity leave is a different issue. Now, if you work at a bigger practice where people can cover for you, that is all nice and well. But many of us dentists, especially women, work in a small practice atmosphere. And I have a 2-chair practice. It is one of the smallest practices that you can have. I actually call my practice a micro practice, and I think I'll do another video on that too. But my micro practice does not go round if I do not show up. And so if you are on maternity leave, that is a strain on the business. My maternity leave, I took off 4 weeks. I ended up getting 6 weeks because I went into labor early. But the amount of time that I had scheduled off was 4 weeks. And I had a C-section that got infected. By the time I came back to work, I could still barely walk. And I did not really understand, I mean, if you've never had a baby before, you don't really understand what goes into the labor and delivery process and the healing. I didn't put a lot of emphasis on my own healing as a new mom. And looking back, I wish I did, because what I've realized from going through the process of having a baby and still like the practice, survived, I realized I have to put myself first, and that's what's hard about practice ownership, but I'm digressing. Taking off 6 months like what other people do for maternity leave, that is not possible if you work for yourself and you're the only productive human being in your practice. And yes, you can get like people to come in and temp for you. There are ways to be creative, but in a 2-chair practice like mine, people don't come to the practice to be seen by a temp. They come because of me. Funnily, I did have an associate at the time. I had an associate for about 5 years. She only worked at my practice like 1 day a week, but she was also pregnant at the same time as me, and we gave birth like 1 month apart from each other. And so it was absolutely not useful to have an associate for when I was giving birth. But anyways, I love her. I miss her so much. Anyways, yeah, it's hard to take time off. I think for me, I realized during the pandemic how limiting dentistry is. And I think a lot of people realized this. If we don't go to work, we can't make money. It's so suffocating to feel like that when we were like stuck at home because of the pandemic. The other thing is like sometimes me and Byron are like, oh, let's try moving to Nevada to save on taxes. Cannot do that. We both own practices. We would both have to sell our practices and then move. So once you have a practice, you are very, very limited. You can't take time off. You can't just move around, like you are sort of stuck. And you better not get sick. So this one, number 4, hard to work from home, is a legitimate one for me. I want that ability. Okay, number 5, the 5th thing that people hate about dentistry. This one's gonna surprise you because I don't think I've ever seen a video where people talk about this. It's the dentists. People actually said that in my comments. It's the dentists. The dentists make it miserable to be a dentist. It's because a lot of dentists are very, very competitive and sort of mean to each other. And actually, I did see a video. Dr. Jordan Brown, he did like a short reel, and he was talking about how in certain Facebook groups, like you can see the forums of dentists talking to each other, and they are so mean to each other. Like, what is up? I also think that dentists are way too mean to each other. Not collaborative, but very competitive. I feel extremely lucky because I've connected with so many dentists on Instagram that like we are legitimately, like we talk all the time. We're all moms and dentists, and we just connect really, really well. But I've been to CE courses where there's like some asshole in the corner and they're always like trying to one up the speaker. And I'm just like, let the speaker speak, you know, save your question for the end. Stop trying to one up him. Like, it's not a who has bigger balls contest, okay? Just let the speaker do their thing. There's something wrong with the way that some dentists are like so egotistical and the way that they treat each other. This has to change. This has to change moving forward. I do think that a lot of dentists are starting to be more collaborative. At least that's what I do see, or like that's what I personally experience. But there is still this like very unhinged part of this profession where things could go south real fast. People will pile on you and they will just be mean. It is very sad for me to say that. Sometimes dentists are the worst part of their own profession. I also got a few messages from associates, and I put what they said in this category. They said, as an associate, rude bosses, bad management for associates, difficulty finding a stable job. So if dentists are being assholes to each other, imagine how bad they are being to junior dentists that work for them. Obviously, this will really depend on who you work for. Not all dentists are bad. There are so many good, amazing dentists out there. But if you do happen to work for a mean one, then your life is gonna be miserable. It's kind of like if you've ever taken like a chemistry class and you had like a mean teacher, it just makes chemistry suck so much more. But if you have a really great teacher, it will make or break how you feel about chemistry. Same thing when you're an associate. So, and I've even heard from like dental assistants that they've worked for doctors that would like throw their alginates across the room after they looked at them like, this is such a bad alginate, throw it across the room. That type of behavior is so unacceptable in modern times, but still happens. The other thing with associates, somebody said, is you gotta make do with the equipment that they give you. And that's not, it's not really specifically under this category, but just wanted to highlight that that is one of the things that associates do go through, is that sometimes what's provided to them are like Tafelmeyers instead of Garrison matrices. So you don't really get to choose what materials you work with. You gotta make do with whatever you have. And if a dentist that you're working for is operating their business to be high volume and low overhead, then you just have to work with that. But anyways, like I was saying in my chemistry story, you just have to work for somebody who is nice. And there are plenty of nice dentists out there, but there's also plenty of not nice dentists as well. And it sucks that we have to be talking about this, but it is the reality of the situation, right? So I know that that last one was kind of controversial, but overall, do you guys agree? If you are dentists, do you guys agree with my list of 5 reasons people hate dentistry? Please also weigh in if you disagree or have something to add. And also, if you are thinking about becoming a dentist, knowing both the pros and the cons, do the pros outweigh the cons? Are you still excited to become a dentist or excited to learn more about the profession? The goal of this video wasn't really to deter you from any of that. It's just to be as realistic as possible so you have a better feel of what's going on the back end of the profession, because a lot of what's on Instagram is over glamorized, and that is just another issue. But I wanted to be as transparent as possible. And thank you to all these dentists that weighed in, and let me know in the comments below if you have any video suggestions. But my next video I was thinking about doing is whether dentistry is still considered a good profession for a girl. I know that when I was looking into dentistry, people were always saying dentistry is such a good profession for a girl. So we can sort of dive into what that means and whether it really is a good profession for a girl, or if that was like something of the past. So that, I think, is my next video topic. Please subscribe and I will see you next time. Bye.